Area-specific curettes. The name area-specific signifies that each curette can be applied only to specific surfaces and/or areas of the mouth. They are used both supragingivally and subgingivally. They have a rounded back, rounded toe, are semicircular in cross-section, have one cutting edge per working end. The face is tilted in relationship to the lower shank, and they have a long, complex shank design. Only one cutting edge per working end is used for the instrument. The second edge is a non-working edge. To identify the working or cutting edge, hold your instrument so that you're looking at the toe of the working end. Raise or lower the instrument handle until the lower shank is perpendicular to the floor. Look closely at the working end. Note that the cutting edge is lower or closer to the floor than the other edge. The lower cutting edge is the one that is used for instrumentation.
The Gracie 1-2 curette is used specifically on the maxillary and mandibular anterior sextants, that is, from canine to canine, both lingual and facial aspects. The first thing you must do is choose the correct working end of the Gracie 1-2 curette. In this case, the instrument face provides a visual cue. When the working end is placed against the midline of the facial or lingual surface of the tooth, the instrument face tilts slightly toward the surface of the tooth. As you look down on the working end, the face is partially hidden. This is how you know you have the correct working end. Conversely, if the working end is placed against the facial surface and the instrument face tilts slightly away from the tooth surface, you have the wrong working end against the tooth. If you use the incorrect working end subgingivally, you will traumatize the soft tissues. Now that you have chosen the correct working end, please use the following step-by-step technique on the mandibular anterior sextant. We will begin with the left canine. Please sit at the 8 o'clock position if right-handed, 12 o'clock if left-handed, and work on the surfaces toward you. First, position the working end near the midline of the left canine with the lower shank parallel to the facial surface. The toe should be aimed toward the mesial surface of the tooth. Next, use overlapping strokes as you work across the facial surface in the direction of the mesial surface. As you approach the mesiofacial line angle, don't forget to roll the instrument handle to maintain adaptation of the toe third of the working end. Continue making strokes across the mesial surface. Lastly, instrument under the contact area by working at least halfway across the mesial surfaces. Remember, the other half of the mesial surface will be instrumented from the lingual aspect of the tooth. Please follow the usual sequence for instrumenting the anterior teeth, working first the surfaces toward you. Reposition yourself to the 12 o'clock position if right-handed, 8 o'clock position if left-handed, to continue with the surfaces away. Begin with the mandibular right canine and repeat the previous steps.
The 1112 Gracie was originally designed for mesial surfaces of posterior teeth. It can also be used on the facial and lingual surfaces of posterior teeth. Starting at the distal facial line angle, position the 1112 Gracie Curette so the toe is in the forward direction, in the direction you are working. Notice the terminal shank is parallel to the long axis of the tooth. Next, tilt the handle slightly toward the tooth surface with the toe directed apically. Insert the working end subgingivally, keeping the face of the blade closely adapted to the surface being instrumented. Once you're under the deposit, then position the Gracie so the terminal shank is parallel to the tooth surface, establishing a working angle of 60 to 80 degrees. Tighten your grasp with the appropriate amount of lateral pressure. Activate your working stroke by pivoting on your fulcrum and achieving a wrist forearm rocking motion rather than a finger flexing motion. Keeping the lower third of the cutting edge closely adapted to the tooth, use long vertical and oblique overlapping strokes for root planing. Roll the handle and pivot on your fulcrum to keep the cutting edge adapted to the tooth as the curette is moved around the mesial line angle into the proximal surface. Extend the stroke at least halfway across the proximal surface. The 1314 Gracie Curette was designed primarily for distal surfaces of posterior teeth. Your visual clue for the working end when the lower cutting edge is adapted to the tooth surface and the terminal shank is parallel to the long axis of the tooth. This is the correct end. This is the incorrect end. Using a modified pen grasp, establish a fulcrum close to the tooth you are working on. Tilt the instrument handle toward the tooth surface with the toe angled slightly toward the gingival margin. Insert the working end beneath the gingival margin. Adapt the cutting edge slightly mesial of the distal facial line angle. The toe should aim toward the back of the mouth because this is the direction in which you are working. After you have inserted the working end, make sure certain the terminal shank is parallel as possible to the long axis of the tooth. Roll the instrument handle slightly to adapt to the distal surface. Work at least halfway across the distal surface from the facial aspect, using a wrist rocking motion. Keep the cutting edge adapted to the tooth surface at all times. Complete all the distal surfaces in the sextant.
The next instrument we'll be sharpening is the 1112 Gracie. Hold the odd number toward you, being the 11. Place the instrument handle at 12 o'clock. Then tip the terminal shank to 11, one for left-handers. Position the stone again at 12 o'clock and tilt it towards 1 o'clock. 11 o'clock for left-handers. Again, moving in one straight line, start your grinding of the stone on the lateral blade, doing the heel third, middle third, and anterior third, finishing again with a downward stroke. Flip your instrument, and now you will be doing the tip away, again, heel third, middle third, anterior third, and downward stroke. Sharpening the toe on the 11-12 is the same as the 7-8. Place the blade open and the toe towards 3 o'clock, looking down at an open blade with the stone at a 2 o'clock position rotated around the toe. And repeat on the other end. Okay, following with the thinning of the back, 2 sweeps up, and your conical stone. Remove the sludge and check for sharpness. The next instrument we will be sharpening is the Gracie 1314. Hold the instrument in your non-dominant hand with the 13 tip towards you. Use a palm grasp. Hold the instrument at 12 o'clock and tilt the terminal shank to 11. For left-handers, you will be tilting the terminal shank to 1 o'clock. Position the stone at the right lateral surface at 12 o'clock, then tilt towards 1 o'clock. For left-handers, you'll tilt towards 11 o'clock. You will be moving the stone in one straight line, starting with the heel third, middle third, and anterior third, finishing with the downward stroke. Then you'll flip your instrument to the other end and begin sharpening, repeating the sharpening heel third, middle third, anterior third. The next step will be sharpening the toe of the 1314 with an open face blade and the toe facing 3 o'clock. Take your stone, position it at 2 o'clock with short overlapping strokes. Recontour the toe of the instrument. As all Gracies, you will also incorporate the back of the instrument as well as the lateral sides and the toe, thinning the back with a few upward strokes to keep the integrity of the instrument. At this point, we'll use the conical stone to remove any burrs and wipe the sludge off. Test for sharpness.